everyone. Good morning and welcome back to MPHA's 2022 annual conference. I'm excited to introduce our next session on Maine's Public Health Workforce Survey results, strengths, needs, and impacts of COVID-19. This session will be presented by Mackenzie Amity, who is a research scientist at Abbott and an MPH candidate at the University of New England. Thanks for being with us, Mackenzie.
Thank you, Heather, for the introduction. As Heather said, my name is Mackenzie, and I am an MPH candidate at the University of New England. I began my work with MPHA on the Maine Public Health Workforce Survey Development and Dissemination this past spring as part of my applied practice experience for my program. And my continued work with MPHA on this project is being supported by the New England Public Health Training Center. So I'm excited to dive deeper into the Public Health Workforce Survey results and discuss that with you all. First, I have no commercial relationships to disclose. And I just want to thank Maine Public Health Association, as well as collaborators from the Maine Area Health Education Centers, Maine Public Health Training Center, and the Maine Resilience Building Network for collaboration on the survey development, dissemination, and analysis so far. And again, just a thank you to the NEPHTC Health Equity Stipend Program for supporting my work with funding. So to give you an outline of what you'll be hearing today, first I will go through an overview of the Maine Public Health Workforce Survey itself, including its development and dissemination. And then we'll go over some of the survey results, including the workforce demographics and key findings from the survey. And last, we'll discuss some recommendations and future actions based on what we've learned from this data. I do want to mention that the presentation today is a high-level summary of the survey results. The survey was quite extensive and produced a lot of data that we just don't have time to go over today, but there is an extended data summary attached to this presentation webpage through the conference website. If you're interested in seeing more details about the data and analysis, you can download that, and we'll also be eventually generating a report to discuss all of these findings in greater detail. So the Maine Public Health Workforce Survey was developed in response to a 2021 CDC report on rates of depression, anxiety, post-traumatic stress disorder, and suicidal ideation among public health workers during COVID-19. And this 2021 report found that 53% of public health workers reported at least one symptom of at least one mental health condition in the past 2 weeks. And if you were in Amber's keynote speech, you would also heard that the recent PHWIN survey found that 60% of public health workers in regions 1 and 2 were reporting at least one symptom of PTSD. And so it is data like this which prompted many states across the country and public health associations to want to assess these trends in their own public health workforces, and that included Maine and MPHA. At the same time, MPHA saw an opportunity to describe Maine's public health workforce and how public health is being conducted in the state. And so these ideas and goals led us to develop the Public Health Workforce Survey with 3 overall goals. The first, to characterize Maine's public health workforce. The second, to describe how the COVID-19 pandemic impacted Maine's public health staff and volunteers and their work. And the third, to describe the future of Maine's public health workforce. Many of our survey questions were adapted from the Public Health Workforce Interests and Needs Survey from the de Beaumont Foundation, as well as the Mental Health and Wellbeing Assessment from the Institute for Public Health Practice at the University of Iowa College and the Iowa Public Health Association. And those questions, which were sourced from these surveys, largely kept the same format with language adapted to suit the Maine public health infrastructure. In addition, we collaborated with representatives from the organizations I mentioned previously to adapt questions, adapt the language, and also develop additional survey questions to fulfill our specific survey goals. And representatives from the Maine CDC also provided input on certain survey questions and dissemination strategies based on their experience with the PH-WINS survey. I also just want to mention that anybody who identified as a public health worker was invited to take the survey. And we used SurveyMonkey for our data collection. The survey link was distributed via 4 emails over 2 months to MPHA's listserv, as well as partner organizations listservs. And it was also shared with state employees through collaboration with state organizations. The survey was open from May 24th to July 29th this past summer. And during that time, we collected 249 total responses. And this response rate was something we were very satisfied with, especially given that the survey was open to those who identified as a public health staff or volunteer. We feel that this response rate gives us a good fraction and representative population of the workforce. A quick note on analysis. While most of the data presented today is summary data, there were some analyses performed, and all statistical analysis was performed in Stata, and qualitative analyses of open-ended response questions were performed with Atlas TI software. And if you're interested in some of the analytic methods, those are detailed more in the extended data summary that I mentioned earlier. But to dive into some of the results, the first portion that I'll go over is the workforce demographics. So the first goal of the survey was to describe Maine's public health workforce, and we did this through demographic questions, as well as questions about respondents' work settings, service areas, and funding. So through the survey, we found that the largest portion of respondents were those aged 35 to 44 years old at 28.5%. And this was followed by those aged 55 to 64, and then those aged 25 to 34 and 45 to 54. The majority of respondents identified as female, nearly 78%. And 15.5% of respondents identified as male, with less than 2% identifying as non-binary or trans. In addition, the majority of respondents, nearly 84%, reported their race to be white, and less than 5% of respondents were Black or African American, Hispanic, or Latinx, identifying as 2 or more races, or American Indian or Alaskan Native, Asian or Asian American, Middle Eastern, or Native Hawaiian or Pacific Islander combined. We also saw that the workforce is quite educated, with about 47% of respondents having a master's degree as their highest level of education, and 31% having a bachelor's. Respondents also reported being employed in the public health workforce for as little as 0 years all the way up to 44 years. But on average, respondents reported that they had been in their current position for 4.4 years, with their current organization for 6.9 years, and in public health practice in total for 12.3 years. The majority of respondents were full-time staff employed directly by their organizations, and contractors providing third-party services made up the second largest group of respondents at almost 15%. Also, just over 50% of respondents worked in a non-supervisory capacity. We saw that state government employees made up the largest portion of survey respondents, making up approximately half of all the survey participants. And this was followed by the second largest group of respondents being from nonprofit organizations at nearly 20%, and less than 10% representation from other sectors, including healthcare system, local and municipal government, hospital or healthcare clinics, university, private industry, etc. In addition, the majority of respondents reported that their organizations fulfill public health services at a statewide level, with nearly 70% reporting that their organizations served statewide. And 17% of respondents reported that their organizations serve 2 or more localities. And those 2 or more localities included any combination of rural, suburban, urban, and statewide. Lastly, we asked about where respondents' organizations were receiving their public health funding from. And we saw that the majority of public health funding comes from federal and state government grants. For this question, respondents were allowed to multiple select, which is why the sum of the percentages is greater than 100% here. We also saw that contracts made up about 25% of public health funding, and notably, 21% of public health funding came from philanthropic grants. And this is notable because it not only speaks to Maine's community and the amount of philanthropy that is occurring, but it is also something important to consider, in that nearly a fifth of the public health funding, that public health work is dependent on this philanthropy. So next we'll dive into the second part of this presentation, which will describe some of the key survey findings with an emphasis on impacts of COVID-19. Before we get into COVID-19 specifically, though, there was a clear trend that emerged from survey data about workforce employees and their work settings, and that was that the workforce is very mission and values driven. This was apparent in a number of questions, but most obviously through this set of questions, which asked respondents to rate their agreement on a 5-point Likert scale, with a number of statements regarding their organizations, supervisors, and workplace environments in general. On that 5-point Likert scale, a score of 1 equated to strongly disagree, and a score of 5 meant strongly agree. And for clear interpretation of respondent attitudes and reporting of this data, the responses were categorized into 3 groups: either disagree or strongly disagree, agree or strongly agree, and neither. 3 statements assessed respondents' attitudes about mission and values. These included an organization's mission and values being important to respondents feeling that their organization fulfills these missions and values, and that their work contributes to this fulfillment. And as you can see, a strong majority of respondents agreed or strongly agreed with these statements, 95% agreeing that their organization's mission and values were important to them, 91, almost 92% feeling that their work contributed to the fulfillment of their organization's mission and values, and a slightly less majority, but still a very strong majority at 81%, stating that their organization does fulfill its missions and values. The second way in which this was apparent was through a series of questions in which respondents were asked to rate on a scale of 1 to 10, with 1 being not important at all and 10 being very important, how important certain factors were to their decision to stay or leave their organization in the next year. And while job satisfaction, flexibility, and satisfaction with one's supervisor were rated as the top 3 reasons why participants were staying at their organization, pride in the organization and its mission was the 4th highest rated factor for influencing why people stay in their positions and with their organizations. And that had an average rating of about 7.8 out of 10. Now, moving on to look at COVID-19 and its impacts. The second key finding was that a majority of respondents contributed to COVID-19 response and continued to perform their regular job responsibilities in addition to those related to COVID-19. And if you were at the keynote talk, you will have heard some of this data before, which really shows that the majority of public health workers in Maine contributed to the response, and I'll just refresh some of that data here. First, 64.5% of respondents served in a COVID-19 response role, whether that was partially, fully, or being hired specifically to serve in COVID-19 response. And of those who did perform in a COVID response role, nearly 89% performed both their regular job responsibility and those related to COVID-19. So this is showing us that a strong majority of the respondents and of the workforce were asked to juggle multiple public health priorities and really engage in these emergency roles. At the same time, those who were performing COVID response, 63% of those in COVID response spent half their time or more on this response. And to this day, 42% of respondents are still performing COVID-19 related tasks in addition to their regular job responsibilities. So this is really showing us that the public health workforce really came together, but also that the majority were asked to engage in COVID response and juggle multiple priorities for really the last 2.5 years. The third and very compelling finding from our workforce survey data so far is that despite the challenges presented by COVID-19, the majority of participants were not significantly impacted by COVID and reported overall positive experiences. This is particularly compelling given the data that we have from the CDC report, the PH WIN survey that Amber discussed, and seeing data from other states where very significant negative impacts were reported in a majority of public health workers. And there is a lot of data from this survey which goes to support that Maine's public health staff were not as negatively impacted as we might have thought. So the first indicator of this is that survey respondents were asked to rate their overall current mental health, and 81% of respondents rated their overall mental health as good, very good, or excellent. And you can see that less than 5% rated their mental health to be poor. In addition, I performed some statistical analyses in Stata and found that overall mental health was not significantly impacted by serving in a COVID-19 response role, by the amount of time one spent on COVID-19 response, or by the fact that they had to perform both their regular duties and those related to COVID-19. Additional evidence for this finding came from respondents' ratings on a 5-point Likert scale about their experiences specifically working from home. And data from these questions showed us that the majority of respondents had positive experiences working from home, where the majority agreed or strongly agreed that they received organizational support to transition to remote work, that they were able to transition quickly to remote work, that they were just as effective at their jobs while working from home. They felt able to separate work and home when they were working at home. They were able to feel connected to their coworkers, and they felt safe returning to the website. Or to the work site, excuse me. Additionally, using the Likert scale format that I mentioned previously and the grouping into 3 categories, we asked respondents directly about the potential negative impacts of COVID-19, specifically regarding workload and work environment, balancing work and family obligations, discrimination, economic status, and overall mental health. And while there were portions of respondents that indicated they were impacted by COVID-19, and this was indicated by a response of agree or strongly agree with these statements, there wasn't a strong majority of participants who reflected that they had been negatively impacted by COVID-19 in these areas. And in fact, the portion of respondents who disagreed or stated that they had not been negatively impacted was usually equal and at some times higher than the portion of those that agreed. In addition, despite 42% stating that their overall mental health had been negatively impacted, we saw in previous slides that 81% of total respondents are still reporting a positive mental health status. And a majority of respondents reported being satisfied or very satisfied overall with their job, organization, pay, and job security. You can see that there are majorities here of reporting satisfied or very satisfied. I will note that pay had the lowest agreement of being satisfied or very satisfied and the highest level of dissatisfaction. And that is something that we explore further in the extended data summary and is something to think about as we inform our future actions. But overall, the majority of respondents reported being satisfied or very satisfied, especially with their jobs, with nearly 78% saying they were satisfied with their jobs. This is also a hopeful indicator to us that COVID-19 isn't having significant impacts on the potential future of the public health workforce. And this future of the workforce and impacts of COVID-19 was affirmed by nearly 80% of respondents stating that COVID-19 did not influence their next year career intentions or decisions to leave or stay at their organization for the next year. To solidify this trend that we saw, I also performed a statistical analysis in data and found no significant association between time spent on COVID-19 response and whether or not one intended to stay or leave their current organization in the next year. So all in all, this data suggests that a majority of the workforce were not significantly negatively impacted COVID-19, but I do want to acknowledge that there were still portions of respondents that were impacted by COVID, and exploring those impacts is also important and will inform future actions and recommendations from this data. And through the survey, we found that among those who were impacted negatively, the most prominent challenges cited were increased workload, challenges with parenting and working, and feeling isolated or disconnected from colleagues. And these effects were seen in the impacts of COVID-19 question, which I showed previously, where 42% reported that it became difficult to manage their work environment or workload. 34.6% stated it was difficult to balance work and family or home obligations.
Found it hard to balance work and family obligations.
Stated that their overall mental health had been negatively impacted. In addition, 37% of respondents indicated that they struggled with feeling connected to their coworkers while working from home. The open-ended responses, which were optional, also invited participants to expand upon their work experiences during COVID-19 and provided us with additional insights about the negative challenges that people may have faced. And as I mentioned before, I used Atlas to perform qualitative analysis, and these methods are detailed more in the PDF that you can download from the website. And I don't want to spend too much time on this slide in the qualitative analysis because there is a lot that we could dig into and discuss. But I do just want to mention that the top 3 negative impacts mentioned in open-ended responses were increased workload, challenges with parenting and working, and negative experiences working from home, which included struggles balancing work and home obligations. And these basically directly mirror the data that we saw in the close-ended responses. To summarize the impacts of COVID-19 that we've seen, we saw that a majority of respondents supported the state's COVID-19 response and continued to perform their regular job duties in addition to COVID-19 related tasks, and that this is still true for a good portion of the workforce. Overall, the workforce reported adapting to remote work quickly and effectively. The majority of respondents reported a positive mental health status, which was not impacted by COVID-19, and most participants indicated that they had not been significantly impacted by COVID-19. But among those who did report negative experiences, the most prominent challenges were increased workload, feeling isolated or disconnected from colleagues, and challenges with parenting and working. Again, this is a quick look into the data generated from the survey, but what we've learned from this survey has given us direction for next steps. The first of which is to continue dissemination of the survey results. And this will also be accompanied by a report eventually, which will include a much more detailed look at all of the data. In addition, an evidence-based approach will be at the forefront of all future actions. If you are at Amber's keynote speech, she really discussed a lot of great evidence-based approaches, which will be incorporated into MPHA's next steps as well. But some broad ideas include exploring partnerships with organizations already working in workforce development and resilience building, and exploring development and implementation of trainings and strategies for management and senior leadership, as well as for individuals, for building resilience, combating burnout, and fostering inclusive and supportive work environments. We also intend to eventually perform a follow-up survey to measure progress. And as I said, these are some broad action items as we're still processing the data and finalizing our next steps. These are the general directions that we intend to take. With that, I just want to, again, thank those collaborators and individuals who contributed to the development, dissemination, and analysis of the workforce survey so far. And with that, I'm happy to take any questions.
Thank you, Mackenzie, so much. That was a great presentation and a lot of information. You can find, as she mentioned, a more robust slide deck on her session description. And we have some comments from the chat that this is fantastic and other states would likely want to replicate this work. And they did ask for more detailed results, but you added that in the slide that we will be putting out a report as we continue to work through the data and find implications for it. One of the things that I'm really heartened by is how mission-driven and values-based our public health workforce is here in Maine, and to see how long folks have been in their current positions with intent to leave. So can you talk a little bit, and I know it wasn't necessarily included in the slides, but about the future of the public health workforce and who's intending to stay in their positions or leave, and what that looks like as we go through workforce development?
Yeah, absolutely. So we did have a section of the survey which specifically focused on the future of the workforce. And again, I wish we had time to discuss all of it because all of the data are really compelling. But overall, we found that about 72% of the survey respondents were intending to stay in the public health workforce, and a little over 60% were intending to stay in their current job or with their current organization. So it sounds 40% sounds like a lot of people who are intending to leave their job as well. But when we broke that down into what their future intentions were, a decent portion, about a third of those who intended to leave were planning to retire. A decent portion were pursuing further education, of which some people did not know their post-education plans, but intended to stay and return to public health. Some people were transitioning to non-public health jobs, and again, about a third of those intending to leave were staying in public health and just moving to a different organization. And we did also evaluate the reasons for staying and leaving, which I touched on briefly, but that also gave us some insight about what is influencing future career intentions, and gave us kind of a hopeful indicator that the public health workforce still remains pretty steady and stable, and people are largely not intending to leave.
Thank you so much. And we do have just 1 minute left. I'm not seeing any other questions in the chat right now, but I'm sure you will be getting lots as people digest this information, and you can interact with each other through the conference platform. So please send Mackenzie messages if you have any. And I also want to thank the 249 people who took this survey. We were really pleased with that response rate. So thanks everybody, and stay tuned for more information on the survey. A reminder to please take the evaluation, which is in the chat, and you can find the evaluation for each session in the session description. And with that, we will take a 10-minute break and resume at 10:20 to talk about harm reduction. Thank you.